Okay, welcome all. How you doing? Episode 23. Let's talk about on the Sports Therapy Association. Thanks for joining us. If you're watching the recording on YouTube, then that's great. Make sure you click subscribe. But as always, we do encourage you to try and join us live. This is going to be a good example tonight because I'm hoping there's going to be some great discussion in the group with regards to, well, the future of sports therapy. Do we need to get rid of some stuff? Do we need to kind of help each other see, is there one way? Or do we have to guide people towards a certain way? Is it kind of a funnel process? If so, how do we do that? Or are we jumping on the wrong bandwagon if we think everyone's got to do the same sort of thing? Loads of questions. I'm really excited to be joined tonight by the Massage Collective, who are three great minds who most of you will have seen before, powerful in their own unity. So imagine the three have come together now and it's like something out of Marvel. It's fantastic. So I'm not saying which is Wolverine, but they're a powerful collective, as the name suggests. So yeah, very excited to bring them up shortly. Just going to make sure I can see somebody in the house here to make sure we are live. There we are. Timothy, Lee, Sue, Mark, Chris. How you doing, guys? Thanks for joining us as always. If you want to share it to your timeline just to get more people knowing about us, then that'd be great. What's it? Watch party thing you can do. We may well be going live on YouTube. I'm not sure. I keep setting it to try, but it never seems to work. But anyway, before we do that, let me just say thank you to last week. Where were we last week? We were with, of course you were, Chris Kitson, who is in the house again tonight. It was a fantastic episode. It's on YouTube now. It was all about another very important topic about the future of sports therapy, which obviously we're talking about with COVID-19 because it gives us time to reflect about, would we actually benefit from regulation? We've seen that on Facebook there's an awful lot of discussion now, quite heated discussion about what's our association doing for us, and this wouldn't happen if we were taken seriously. We need statutory regulation. Why don't the government recognise us, etc., etc.? And it's to be understood. There's a lot of people who are faced with some very difficult financial situations and low esteem and motivation. So if you missed that episode, it's on YouTube. It was great. Chris Kitson was good enough to join us because he's actually decided to come out of osteopathy and no longer be part of that, powerful regulating body. No longer is he an allied health professional. And he gave us reasons for that, showing that some of the problems with being part of a regulatory body. So yeah, we went 2 and 4, but it's definitely something to look at on YouTube and share with your friends. Very topical, but tonight's going to be just as topical, if not more, as we talk about the future of sports. The future of soft tissue therapy. It's an important distinction because by soft tissue therapy, we're not just referring to sports therapists. We're talking to anybody who works with soft tissue. Okay, and we might have a discussion later on to who that actually includes, but we'll see. So yeah, all these shows are on YouTube, but tonight, like I say, it's all about Massage Collective helping us answer that very serious question. So I'm going to get rid of the artwork and bring up something far prettier. Or what order do I bring them up in? As if I have to decide. Hello.
Oh, good evening.
How are you?
Molto bene, grazie.
Matt's down there just shaking his head going, oh, what a flirt. Unbelievable.
Smooth.
It's in no particular order that I bring you people up. It's just coincidence, the order that you three appear.
From the youngest.
Hi, angels. How are you both? I've left Charlie down there for a while. Just to
I was sure you were talking about Matt's beard when you were saying something far prettier.
Oh, that was Wolverine. No. Anyway, let's bring him up. Enough of this petty rivalry between two Matts. There's enough room for two Matts in the world. How you doing, mate? Right. How are you?
Right. Now the Avengers have assembled.
Brilliant. Thank you for joining us, you three. I've been really looking forward to this all day since we had a little chat this morning. Let's just have a quick look to obviously people in the house, because as always, I say the conversation needs to be steered by you guys. We're all here to try and answer any questions you might have and maybe have our own views. We're totally open to having our own views changed by your input, because a lot of the time it's you guys, maybe in some cases, who are on the shop floor more than us. We're all involved in education as well, which takes us maybe a bit out of clinic. So we want to hear from people in different situations. People are working from home, people are working in clinics, people in multidisciplinary, people are in different regions of the country because the rules might be different, people from different organizations. It's not all Sports Therapy Association here. We have people from other organizations, and we're keen just to hear from as many different points of view as possible. So don't hold back tonight, people. I kind of joked in one of my posts, no holds, it's kind of todo vale, it's everything counts and you can punch and there's no rules. The only rule is what happens in Let's Talk About stays and Let's Talk About. Apart from that, let it out. If we say something which you disagree with, like cupping's a joke and should be banned from sports therapy, then that's fine. You speak out and tell us that that's wrong. I'm just flicking.
You're really trying to wind people up early, aren't you?
No, I've just used that as an example. If you want to stick pins in people and think you're doing something, that's great, but maybe you should be in a different profession. No, I didn't say that. It's just an example. It's just an example. If you think that helps, then that's fine. It's not going to shove our industry down the toilet. Right. So how are we going? Gary is obviously in the house. We can't have more than 4 people on screen, I'm afraid. But Gary is definitely here, waiting in the wings, as he says, answering questions as they come up. So there you go. Also, hello to Caroline McKendrick. Thanks for joining us. But there's loads of people here tonight. Looks like we've got to. This is going to be a big show. Look at this. I've just been another 10 minutes, guys. I'm just working my way through the people here. It's 45. We haven't said anything yet. There we go. Right. Well, thanks, people. Thanks so much for joining us. I hope, nearly 50 people here now. So please talk away, especially if it gets a bit heated. I'm not joking. I'm deadly serious. But I want you to, if you disagree with something we say, then bring it up. Bring it out. Okay. Let's go to the people in the room, the Massage Collective. That wasn't me. I didn't get rid of you, Matt. You just disappeared.
Honestly.
So before we do, guys, just for anybody, there's a few names in here who I'm not totally familiar with, which reminds me that not everybody knows what the Massage Collective is. So if one or all 3 of you want to have a little intro of how that came about and what its goal is.
So we are a group of very passionate soft tissue therapists who got together to share ideas and bring evidence-based practice into soft tissue therapy, and communicating that very important message of mindful and evidence-informed practice to colleagues. That's as simple as that. We felt that there was so much misinformation out there, and because of that, people might be practicing the way that might not be the most effective for them. But also, sometimes people do not know where to find the information. So that's why we got together, 3 like-minded people.
Go on, Becky, you go next.
Sure. This is all that happens with us 3 is we interrupt each other. We wanted a voice for massage, manual, soft tissue therapists, whatever you want to call us, but therapists that still do use manual techniques and use their hands, because we all felt you kind of had 2 options really, which was to tap into CPD that was very physio-led and maybe didn't speak to exactly the way we practiced, or you listened to questionable narratives and there wasn't that stepping stone. So we're hoping that we're providing that a little bit. It's the something that you can listen to and go, yeah, there's someone that does my job, and challenge your thinking, and as Anna says, bring some evidence into that.
And Matt, how's it going with the podcast? Tell us about the podcast as well, because you've got 3.
Yeah, well, 3 episodes out so far. The 4th one out, I'm losing track of days, this weekend, actually, this coming Sunday. And then our next one will actually be a live recording from Therapy Live Sport, which will be interesting, to say the least. But I think the thing with the podcast as well, and my slightly more blunt approach, I suppose, to wanting to be a soft tissue therapist, talking about evidence in practice is I love what we do. Okay, so to sort of start the conversation, I love what we do. I love using hands-on techniques, but I'm slightly fed up with the way that complementary therapy has been sidelined into some sort of woo collective, and we're not necessarily given the right seat at the table, I don't think, when it comes to the more mainstream healthcare. And I've got to be honest, I think a lot of that is of our own making. I think we need to learn how to speak the right language and bring our treatments into the modern age a little bit, and as much of that comes from the way we talk about them as much as it is the way we do them. And so the podcast for us really is an opportunity to pick up on a topic that's either intrigued us that week or that sort of just stands out, I think, in general, and allow us to dive into that. What is the evidence behind it? How can we discuss this in a more evidence-based way? And importantly, so that our the people who choose to listen to us can actually go away with some useful information they can use there and then. That's something that we set right from the start. I think when we sat down and started fleshing out what does this look like as a podcast, we all agreed it can't just be three people talking for the sake of talking. This has got to be constructive and go somewhere. So hopefully people who have listened to it so far have found some useful nuggets that they can go away with and actually implement that day in clinic. That's certainly what we're intending to do. And if we aren't quite hitting it yet, then please let us know.
Well, I don't have to sound biased, because one of the things I love about the podcast so far is I don't actually know what's going to come up. I kind of know you guys, and known you for a while, and I love everything you do, but it's still that kind of subject where I don't know how they're going to defend it, what they're going to say, or how they're going to interpret it. So it's kind of exciting. The format is great, and I particularly love, and I mentioned this morning when we were chatting offline, the kind of, how do you call it? It's not the takeaways, the kind of 3 things to take away at the end. You came up with a great catchphrase.
Theory to practice.
It's beautiful, because there's not enough of that in our industry, is there? There's a lot of whinging and whining. Massage doesn't do this, massage doesn't do that. It's like, okay, what can I do? So that was good.
This is exactly what we wanted to be proactive. We know what's wrong in our industry. We know what could be done better. Let's now translate that, because that's what it is all about, is translating. Because for people that went to university, and you did a great web chat a few weeks ago, I really loved it. But for people that went to university is for certain type of learning. And those people are already accustomed to the critical thinking. You don't always find that in vocational qualifications, but it does not mean that they are any less. But it means that somehow we have to bring that critical knowledge there. We have to translate, and that's what we feel we are doing. We're translating. Because 3 of us, we are very different. We are very, very different, and all of us we go from very academic to a full-time practitioner.
To me.
To a full-time practitioner. Oh, no. Well, the thing is, I am not an academic, and for me, it's not an offensive word not being academic. So it's not offense to anybody not being academic at all. It's how people learn and how people think. Sometimes
it's one of the problems in a lot of industries. Maybe sometimes some fractions of physio have suffered, like Adam Meakins would refer to the dinosaurs. The academics get too involved, and suddenly you get this hierarchy of people looking down on anyone. So it's definitely not an insult saying to someone that you're not academic enough. Sometimes it's an insult saying you're just academic. So
the STA put up a fantastic post yesterday or 2 days ago when he said CPDs is actually about you as a person. That's what is important in your intervention with your client or patient. It's you as a person. So no degree or vocational.
And I think sort of taking the academia thing, because funny enough, that issue of sort of those in the ivory tower of academia coming up with ideas and disproving things and proving things, and then actually the people on the ground in that industry getting their hands dirty, as it will. That comes up in all facets. I think we're MSK healthcare is definitely not unique in that, but I think what we are seeing in MSK healthcare, and this will probably touch on where I think the future of soft tissue care therapy is going, is that we are understanding more about what it is that we're doing now, thanks to the evidence, which is coming from academia. But at the end of the day, that academia is based on statistical large population analysis. And we work with an individual one-on-one in a clinic. And for me, the translation of that academia to the clinic is a spectrum. And it's not a case of, oh, they've no idea what they're talking about, I work in clinic. It's more a case of, let's take what they're applying statistically population based when they're doing their academia, and let's move along to work out where I need to be with this client in front of me. Is it that this person is so complex that actually I need to be just one-on-one with this person and work off my own experience that works here? Or actually, am I looking at someone who's strained a calf muscle, in which case I can sit more close to our understanding from academia about the right way to go about rehabbing that individual?
I listened to that and I'm worried, Matt, because what I hear a little bit, what I hear is a little bit, because the most common rejection of research, normally this is something else we could touch on, by clinicians who maybe haven't got the time or the time management to actually look at research, because it takes a little bit of understanding of where to look, some of the shortcuts and stuff like that. One of the most common excuses is, oh, science, they're not on the shop floor, they don't know what I'm doing, I'm working with an individual, it's me and the patient and they're an individual, so maybe, and it's used to kind of support different modalities and things. Well, this works with my patient and I'm fine with that working, because when I do slap their bum with a kipper 5 times a week, they say it's great by the end of it, and in 8 weeks the pain's gone, so I'm going to continue doing that. And that's kind of, I worry about that, because I'm pretty sure that all the people who I criticize, well, not to their face, but behind their back, they support their interventions by anecdotal evidence, by not thinking about kind of natural healing, not thinking about regression to the mean, and all the kind of things which we know can support anything.
And this is definitely, and I know I can tell Anna's desperate to jump in here as well, so I'll say my 2 penneth and then leave it to Anna. But this is an area that if there was anything that would keep me awake at night around soft tissue therapy, this is probably it. And to dive in very quickly to sort of philosophy of science, the way we conduct scientific research nowadays is one way of doing it. It's not necessarily the best way of doing it. It's just a way of doing it. It's known as a paradigm. It's the way that we've decided to do science. But science in that context is statistical and based on the average. But an individual is far more complex than that. The scientific research that's done in labs requires us to eliminate all but 1 or 2 factors that we can then measure, so that we can confidently say that factor has led to this outcome. That's not reality. And this is recognized, that in all facets of healthcare in particular, applying that statistically based population-wide analysis to the individual is very, very difficult. I think to sit in either camp, however, is to miss a huge chunk of the reality. The reality is that we know statistically that half of these modalities don't work the way that they are claimed to work. And we've got to be very careful about what we mean by work. Of course, we can come to that later. But the individual in front of us is insanely complex, and we need to be comfortable working with that individual. And so I would, quite often, I think, challenge the Adam Meakins of this world, who just sort of, I'm going to say the sports physios of this world, because it's definitely the persona that he provides on social media, that, if it doesn't come from an RCT, then why are you using it? But equally, I would challenge anyone who says, but I've been doing this for 20 years and it just works. I think both are wrong.
I think all of us have said in the past that it works because I see it work, or I know it works and that's good enough for me, isn't good enough anymore. If we want a voice in this industry and if we want to be respected in this industry, that's not good enough anymore. And it doesn't get us involved in the argument, which is no good for us as therapists, and it's no good for our profession. However, I do think we do have to acknowledge that disconnect between what we read in evidence and what we as practitioners might see in clinic. Now, that's not to say that the evidence is wrong or that your anecdotal evidence is better. It's just to say, as Matt said, yes, we see this in research or in studies. We appreciate that you're seeing something different in clinic because it's complex and because we don't fully understand it yet. Now, that's not a reason to come up with a hokum explanation of how your massage or your cupping or your acupuncture is working, but it's an acknowledgement that we don't know everything, but that we can't dismiss evidence just because we can't fully understand it or haven't got all the answers.
And also rely, Becky, and well, both of you, Becky and Matt, you raised a really great point. And the fact that just saying, but he worked, what does work mean?
Yeah.
What does being effective mean? That's why for me, so just, of course, after a soft tissue treatment, after an intervention, the client may feel better. Does not always mean that it's because of the intervention they feel better, first. Secondly, does our outcome or aim of our treatment is just a client feeling better? We know by evidence is consistently telling us that a client that achieves self-efficacy, which means understanding themselves, they can get themselves out of pain, of injury, they will have a better long-term outcome. So just somebody coming out of your clinic feeling better, that is not enough anymore. That could be a tool, that could be a medium, that could be the first step to gain self-efficacy. But just saying, well, they come, they feel better, I must be good, what I do must be effective. No, it doesn't. Because if the person comes to you every month to be treated again and again for the same things, and just to get the very temporary relief, you're actually creating dependency. And the words you use, because we know also that the words we use can have a nocebo effect, can give harm. I think because we work with people, vulnerable people with injury, people with pain, we have that responsibility to know and to provide what does not give harm. So not only from a manual treatment, but also from language. So if I continue saying to a client, well, your pelvis is stuck and you got leg discrepancy, and just come in, you have to come in every month, every 2 weeks, or whatever it is, so that we can maintain you, for maintenance. What are you telling? What the client hear? The client will hear, something is wrong with me. I'm not strong enough. I will never get better by myself. I always need. So that in itself is dependent. So yes, anecdotal evidence is good at its place, but we need to be very, very, very careful and put it together.
I think to pick up on, I'm loving the comments, by the way, everyone, and there are so many that I want to respond to already. But just to pick up on a couple. So Chris Kitson has said that he doesn't think research provides too many answers. It guides us to ask better questions. And I think asking better questions is fundamentally where we need to go. And we'll touch on that and my biases there later. But I think that research helps us be less wrong. And I think that's important. And I think there needs to be an understanding of what research does and how it does it. And the first thing to say is that research will never prove anything. That is not even the goal of research. Research, under the current scientific paradigm, research is to state something and then prove it wrong. And actually, that's a really important distinction I think people need to understand when they refer to the research. The only reason that we have a theory of gravity, for example, is because we came up with an idea, and no matter how we tested it, it just wouldn't fail. But we can never prove 100% that gravity will act consistently under all circumstances, because we can't test all of those circumstances. So then when we're coming and we're testing a modality, we can't go and say, oh, dry needling works. What we can say is dry needling hasn't worked here, and it hasn't worked here, or it's not behaving like the original hypothesis was. And so I think that needs to be quite clear to people, that when we're looking at research, we're not looking at research to prove ourselves. Well, people often look at research to try and prove themselves right, but research is fundamentally being done in order to be less wrong. And I think if we can be less wrong, then that's really important.
I'd like to, I've just thought of the first take-home thing, which I'd like either therapists in here, if it applies to them, or maybe people watching the recording. We've kind of confirmed that the traditional way of my client feels better after the session, therefore what I'm doing is working, can lead you down a rabbit hole, and it's not a very efficient way. You want your client to be happy when they leave, but you can't base your treatment plan for the next 8 weeks on that. What do you think, any of you, all of you, would be, because I think this could affect a lot of therapists, what do you think would be a more sensible way of recording whether what you've done with your client was actually beneficial?
So there are questionnaires. There are very validated questionnaires available out there. We can put the links up. You can actually use some of your questionnaires and maybe edited and adapted for your own. But what should always be outcome, it should always be, for me, for what I strongly believe, is that the client feels that they do not need to come to you to have, they can manage, they're in charge, they're in control of their life, that even if they get the back pain again, they have repeated back pain, that they do not panic, because they know that they are in control. And they might still want, I have people that come repeatedly to me, but not to treat injuries. They come to me because sometimes I challenge them a little bit more with the program, sometimes just because they want a lovely, relaxing massage, sometimes just because they feel they need to, they say, oh, I feel a little bit of pain. How shall I deal with that? How can I manage that? So to me, I think we need to shift the paradigm and ask ourselves. Actually, Matt Phillips, you asked an amazing question. How do we know? So it's about the beard, and that's what we were trying to. But that's that's an.
How are you going to measure that though? How you get? I'm going to finish with Anna. I'll never finish with Anna. I'm going to go on a break with Anna. But how are you going to measure that? What is it a question? Because it still sounds very subjective. And most clients, it's like the hairdressers. Like when the hairdresser says, "Does that look okay?" Everyone goes, "Yeah, that's fine." And then you never go back to the hairdresser, or you go home and you just go, "Oh my god, what they've done." Whenever a client finishes, you've always got that problem where they don't want to let you down. They just want to get out the door. So I worry about how you would actually record that, make it tangible and measurable.
That's why I say we're talking about questionnaires where people score their own, they're catastrophizing the pain scales, well, some of the pain scales, because some of them are not. So, but actually, do we really want to be that objective?
And this is, I think it probably comes to the subjective of the client.
Yeah. And
I would say that it probably comes down to a thorough conversation to begin with, is what is their measure of success.
Yes.
Because if you can record at the start of your series of treatments or one-off, whatever it is, what is their view of success? If it is, I want to get back to playing with my kids, that's your measure.
But that's becoming more objective now, isn't it? For me, that sounds like, for me, it's more, we forget about the objective. I don't trust any and I'm hoping people in the comments kind of hear this and maybe disagree or something, but I don't trust any subjective kind of comment as being an outcome for what we've done together. I need something objective. So you've just said, right, I want you to go home and try playing with your kids. What happened? And if they say, actually, I managed 5 minutes without my back hurting, great. Well, we're moving in the right direction. We need something tangible.
Then, what can we actually measure that we can actually attribute to the therapy?
But something physical.
The only thing I think we can actually measure that we can attribute to the work of a soft tissue therapist is an increase in strength through rehab.
Don't know.
Because we can objectively measure an increase in strength. Decrease in pain is subjective, and we can't assign that directly to what the therapists themselves have done, because there's just too much going on. We know that healing will occur whether we touch the client or not. So what is it that we can actually measure?
I mean, something functional. Like I had a client recently, a virtual one, and it was simple as it was a shoulder issue. And so I needed something tangible, something I knew. I don't care if it's the solution came through something kind of more psychosocial. I just want something tangible. In this case, it was right. Do you reckon you could get that box off the top of your wardrobe?
But is that meaningful?
And in the beginning, he was like, "Oh no, I can't do that." So I saw him maybe 2 or 3 times online, and eventually each time it was just put your hand up to the top there, put both hands up there, pick up the box, now take the box down, put something in the box. So at least I had something tangible, which was like, okay, well, I'm not sure the mechanism here, but at least you're now doing something which before you couldn't do.
That's right. So at the beginning, when they come to you, you assess what's meaningful to them. For some people, it's meaningful is increasing the range of motion. For some people, it's being able to get up and down the chair or picking up the kids. So if that's what you mean, yes, of course, at the beginning, you're subjective. You go through subjective and objective, but objective, it's very specific to what's meaningful to them, for what they want to achieve. Because actually having somebody being able to fully flex the hip, if actually they came to me because they want to just be able to go up and down the stairs, maybe my attention is not where it should be. It's always it's about client-centered. But I agree with you, Matt. It's great to have, at the beginning you ask them to, as I say, lift something up, 3 sessions down. Can they do that without guarding, without fear, and so on? So from that perspective, yes. But there are
I think that's important as well. The time scale there, in that, essentially we're saying that. I've somehow managed to. I'm assuming you guys can still hear me. I've somehow managed to turn the music on. So I'll sort that out in a minute. But I think the time scale is important, because I think if you ask someone whether they can pick up a box from a shelf when they first walk in, you provide them a treatment, and then you ask them to pick that same box off the shelf at the end of a treatment, I'll guarantee it'll be easier for them. They'll be in less pain and they'll move easier. But that won't last. We know it won't last. It might last them 24, 48 hours, but that in and of itself is actually not a meaningful change, because it won't persist. Now, if you can have that client go home and practice that movement repeatedly and start to overload and start to provide themselves with some exposure, then yes, I think that's something that we can then measure maybe 3-4 sessions down the line and say, we have now made a meaningful change. But I think if we're looking at where we perhaps want soft tissue therapists to focus on their outcomes, I would say they need to be looking beyond the magic hands of one session.
Yeah, absolutely.
You'll have to bear with me because I can't hear you back again in a minute. Hang on.
Becky, jump in. Speak.
I'm trying to. It's hopeless.
Speak an unacademic one.
Yeah. Well, on the point of being unacademic, I think we need to be a little bit careful that we are clinicians and not scientists. So yes, we do need objective measures as to whether that treatment has been effective, or whether the clients achieved the goals that they wanted to achieve from our treatment. Do we need to get hung up on what degree can they now get their shoulder to? I'm less keen on that if that's not their goal. I think a lot of it in terms of, you're right, Matt, we always tell our hairdresser our hair looks nice because we like pleasing people, don't we? So when I say to somebody at the end of a treatment, was that helpful? They're going to say yes, because they don't want to stand there and have that horrible conversation of, no, actually it was useless. But that's where I think establishing an honest, open relationship from the start. And I always say to my clients the first time they come in, look, you're under no obligation to me. And if these are your goals and you feel we're not working the right way for you, and you want to go and see, either you want me to change what I'm doing, or you want us to change our approach together, or you want to go and see somebody else for a different approach, then that's fine. And I hope by saying that at the start of my my interactions with somebody, that I do get some honest feedback, because they feel comfortable enough to say, do you know what, actually, Becky, I went on my own, did what you told me to, and I really don't see any difference and it's not working for me. And can we maybe either reassess that, or can you point me in the direction of somebody else I might like to work with? And equally then, I hope that when you do those follow-ups with those clients, they feel able to be honest with you about whether or not you help them achieve their goals. Yeah. And that, I appreciate that still sounds subjective and maybe a bit woolly, but at the end of the day, it's a subjective thing we're measuring a lot of the time, especially if we're looking at pain. Not necessarily, you know, your person lifting something down from a shelf, that's a nice objective measure, isn't it? But if somebody's come in with chronic back pain and it's not necessarily hindering them, but they're living with pain, that's going to be a subjective measure.
But if normally, even if someone's got chronic pain, I think sometimes people with chronic pain, part of it might be, is it affecting your life? Is there something you can't do? No, I'm fine. I'm just annoyed about this pain. Well, if it's not affecting you, maybe we need to talk about that, because there's plenty of people, but it's tricky. I think with my comments, I just wanted to try and affect therapists whose sole measure of success is, how do you feel? Was that nice? Don't forget to drink a glass of water after success. Toxins all around your body. You might have a headache tomorrow, feel worse, but that's normal. Come back next week, because that is the standard thing which we need to break a little bit. There needs to be a kind of, right, what can you actually do better now? What is it you came here saying you couldn't do this with your kids? Are we closer to that? And if after 4 weeks they're not close to that, we got to start thinking, right, we need to change the direction a bit, because within 4 treatments or so, something has to have changed. I think that's why we need to have something a little bit more tangible.
I mean, 4 weeks down the line, natural healing should have started kicking in, particularly if it's acute. If it's chronic, different, but if it's an acute injury and things haven't changed, then absolutely, I think.
And that again is what I think I was trying to get at with saying that's a dialogue I like to open right at the start. It is, explain that this might be a bit of a process, and we might, whether it's chronic or it's rehabbing an acute injury, sometimes it is a bit of a process, and we try several things. But you need to be honest with me. And if you feel that we're not getting on, or we're not working the way you want to work, don't feel you have to keep coming to me to keep me happy, because what I want to do is see you achieve your goals. And if that means I change the way I work with you, or I help you go to someone else that I think might be better suited to you, then that's just being a good therapist.
I can't remember who said it. It might have been Becky. It might have been Anna Maria. But if somebody said, I think it was you, Becky, I want my client to always leave after session feeling more secure about their body, feeling that they're stronger, that they're more able. I think that's quite a nice tick box, which again could change quite a few therapists' outlook, maybe that take-home thing, because that then addresses language, the mechanisms of action. Am I giving them the impression that I've corrected something which is they needed my hands to do, in which case they're leaving thinking, okay, I'm feeling better, but it's only because they fixed me. That's quite a nice...
There was a comment.
That's something earlier. I feel.
Yeah.
That's, you find the comment, Matt. That's something I feel really strongly about. Is everybody should always leave my room feeling better about their body, more confident in their body. Now, that's not to say that I'm telling them it's going to magically cure and they can suddenly go and climb mountains or whatever. But they feel more confident, they feel happier that their body is or that they are capable of things, and I'm not taking any of that away from them. So whether that's giving them negative things to worry about, like maybe making comments about their posture or how things feel or whatever, or it's me saying, oh, I've released this for you, or I've done whatever you might say, because all of those things take away from that person going away with a better level of confidence in their own ability and their own body.
Ultimately, we need to provide patient or client, in our case, centered care. And client-centered care means that when they come in, amongst all the other questions we ask, one of the questions we ask is, what would you like to go back doing that you cannot do now? So what is meaningful for you? And talking about meaningful, there is somebody here, I wanted just to pick on that a moment, to Craig May. So,
yes.
So if it's meaningful for your client, surely you're saying what I did works. Craig, so yes, if somebody gets better, but it might not mean that it's because of what you did. We know, and there is a research study which we're going to release a little blog soon from Adrian Lau et al. That actually found that people with lower back pain improved just after subjective assessment, then improved a tiny little bit more after objective assessment. So even if you do subjective assessment, there is an improvement in outcome. And we're talking about less pain, not only increased function, less pain. So what we know that what actually might be working, it's the very important therapeutic alliance, which is trust, communication, de-threatening, all these soft skills, which, we gonna this, we always think what is soft and what is not. But anyway, those more communication skills, instead of what you're actually doing with your hands. Say that I am a soft tissue therapist. I love using my hands, and it's got its absolute place, but it's not. When my client go away from my room, sometimes I say to them, you got better because you like my accent. You got better because you have a great relationship with me. You got better because you trust me and you feel safe.
And I think this is, for me, and I can't find, there's so many comments now, I've lost the comment, but because I saw Craig's as well, and I'm glad you addressed that, Anna Maria, because I think it is important. And I think for me, if I wanted to cut to the quick in terms of what I think it is we're trying to say, is you're not fixing clients.
No.
That word, you and the implication that you are doing something to them, I think we have to throw out. Quite frankly, we're not fixing people. Andy Hosgood, if you haven't come across him with Elevate Your Clinic and Therapy Business, Andy Hosgood really challenged me earlier this summer when he said, what is it, what do you sell in essence? What is it a therapist sells? And the long and short of it is, we're facilitators. We provide someone space to explore their own capabilities and provide, exactly as Becky said, provide them fundamentally reassurance. Now, we know that we can have transient effects on their levels of pain and their range of movement through things like massage, through things like cupping and needling and trigger pointing and all that malarkey, but we're not fixing them. We're not changing anything in the tissues fundamentally. What we're doing is we're helping them realize that it's not as bad as they thought it was.
And can I just jump on that quickly? Because Jack Chew's just made obviously a brilliant point. It matters what patients attribute their recovery to. And absolutely. And in my eyes, that's quite simple, that their recovery should always be attributed to them. And that, and if a client says to me, oh, thank you so much, you've made me so much better. No, you've made you so much better. I've maybe give you some direction to go down, but you've gone away and you've done your rehab. You've gone out for a walk when it's been painful and it's been hard. You've done all the hard work. So that recovery should always be attributed to them. If we've opened some doors for them and I think that's something, we've got because the evidence is so clear around self-efficacy, and of course there needs to be self-efficacy, have we gone a little bit too far away from supporting people? So yes, we need to build self-efficacy, But some people like support. Why do people go to personal trainers? Why do people go to exercise classes? It's because they want some support and some encouragement, and to be told they're doing it right, and to be told they're progressing the way we'd expect them to progress. That's our role, to say, yeah, you're on the right lines. Oh, okay, that's not worked, or we've had a relapse. Let's address that. You can phone me. You can have a chat with me because you're concerned about something. I'm not fixing you. I'm just supporting you.
I'm hearing, and it might exist already, and you guys could put it together because you three can do anything. But maybe it'd be nice to produce, if it doesn't exist already, a checklist for the therapist who wants to kind of be part of the future of soft tissue therapy, of where they can critique themselves and the services just provided. Like, box, did the client leave feeling more confident about their body? 2, did I mention that they were fixing themselves? I think some therapists will quite like that. They're obviously not going to get it all, but if they understand that is actually helping themselves, the future of soft tissue therapy, us being taken seriously by profession, they could start maybe modifying and changing. Because often we're not saying don't do any cupping. If you want to make 32 circles elevate and make you think that you're increasing circulation to your client when all you're doing really is making the skin go red, that's fine. But as long as at the end of that ordeal, 1, they haven't been in serious pain, 2, you're not making them think that you're fixing them, and 3, somehow, I don't know how you're going to do this, good luck to you, but you're feeling that they're becoming more confident in their own body's ability. I think with a question like that, people could discover themselves.
I think there's some really good questions in there that you could ask as well. I was listening to a podcast earlier, and one of the bits that came out of that was, how do you identify yourself as a therapist? And this isn't just soft tissue therapist, but for example, do you identify yourself as a brand of therapist, TM, for example? Do you associate what you do with specific techniques? And do you associate those specific techniques with specific outcomes? A question that Matt asked me offline earlier, and again, I saw the comment, and I can't remember who asked it, so I do apologize. But there was this question of, do you choose which modality do you use? Do you use the modality that for the individual? And I have a real issue with this, because modalities as we know them, cupping and needling and all the rest of it, tools, etc., they always come with a narrative that explains exactly what that tool is doing to that individual, to that client. The way I look at things now is that all we're doing ever is interacting with the client's nervous system. What the client finds beneficial in terms of reducing their pain or increasing their range of movement is individual, and we do need to take that into account. And so whilst on one hand I will hold my hands up and say my biases lie similar to where it sounds Matt's lie in terms of the cupping and things, in that I'm just not a fan. On the other, if the client is a fan and they understand that it is doing nothing other than changing their sensation, then why wouldn't I use it?
Sorry,
I was drifting off there, but at the end of it sounded like he was trying to provoke me. I was drifting off, just looking at the comments, thinking, I'll just let it come to an actual. What did you say at the end there? Why wouldn't we use cupping?
Yeah, why wouldn't you use cupping and needling? Why wouldn't you offer cupping and needling and tools and, I don't know, add your branded technique in here? Why wouldn't
you do these things without the idea that you're fixing something, that you're changing the state of tissue, that you are very hard.
See, well, no, but this is a point
the client believes that it's nice and it's helping. That's only because
this is a point that Jack brought up earlier. Jack brought up the other day, which is that unfortunately, it's not just us that have these beliefs. As I say, us as in therapists, the public have it as well.
But a bit like that's like saying my kid who wants to put his hand in the fire, he believes it's going to be nice. I feel a little bit kind of indebted to say to him, well, you know what? It's not actually very good for you because you're going to burn yourself, and it's not really going to solve anything, even though you're cold. Maybe put some gloves on, it's the same kind of thing.
Yeah, absolutely. First of all, it's not the intervention that makes you dependent. It's the therapist that makes you dependent. Sometimes though, who does come to us? Clients who does come to soft tissue therapists or sports therapists? Clients that expects hands-on treatment. Otherwise, they will not be coming to us. So they're already buyers, just coming to us. So they expect that. First of all, we can change those expectations just by changing the room layout, the way you practice, all these things. But ultimately, in order to communicate the high value care, which we should all be striving for, I agree with Matt there. I do not discount adjuncts as appropriate tools to help people understand, because some people need to be exposed to pain-free movement. That's it. So until they're exposed to the pain, to the symptom modification, they're not able to listen, because sometimes they come to us because they've been everywhere else and they've been failed. So if they've been to a physiotherapist and some colleagues are fantastic, some others are less fantastic, and they say they just give me a piece of paper with the exercises, and those exercises, I use the word again, they're not meaningful for the client. The client is alienated. So if they come to me, I know that already just giving them a piece of paper and exercises, it will not work. I have to reframe that, but ultimately we need to strive for high value care.
It's interesting, isn't it? Because I struggle with where I sit with adjuncts and dry needling and cupping and any of that, because my sense is I want to go, they're rubbish, and I want to dismiss them but then if I do that, and if I use my reasoning for dismissing them, then I should be dismissing massage as well.
Why?
Yeah.
No.
I don't see in many examples of primates or other animals them sticking suction cups on each other and kind of lifting up the skin in the belief it's going to help circulation. But I see an awful lot of grooming and care and contact and empathy. I've never been to Bristol. I don't know what they do there.
Have you never wondered where the baboons got their bums from? It's all their cupping.
Well, that's what it looks like. Yeah.
On point.
I don't know. I don't buy that argument of if we do massage, we can do anything.
I think you're right, Matt. And I think that's where my instinct sits, is that my instinct is that massage is a natural primate, even animal hugely interaction. Powerful. So yeah, absolutely. And that's where I sit. And I feel very strongly about that. But then when I try and I find myself dismissing adjuncts with the same argument that I justify massage. But I just think it's worth, I think we need to be a little bit fairer around the argument. And again, I struggle with it. And I think it's okay as soft tissue therapists or sports therapists to say, I struggle with it. I see it work for clients. I don't know why it shouldn't work because the evidence isn't there. What I do think it comes down to every single time is how careful we are with the narrative. And, so I'll put my hands up. I use K-tape on people. When they ask me what it does, I say nothing. Really? I say to them, it doesn't really do anything. Yeah, absolutely. I say it doesn't really do anything, but sometimes it feels nice. And sometimes it gives you a sense that you're being supported. And let's try it. If you go away and you don't think it's helping, take the stuff off. But let's try it. Yeah. That doesn't breed dependency. It's us playing around with something. It might help them go away and achieve, as Anna says, some movement that was difficult for them.
Some people understand the world and communicate. I understand the world and communicate through the body, through touch, through being through touch. So some people are like that. So whatever we're gonna say around that, they'll understand it better, because that's how. And actually, our Matt always says that if it feels nice, that's great. It's feeling good and feeling nice, feeling the kind of
underrated.
It's underrated, 100%.
I worry as well. And it's getting towards like 8:57 now. I do want to make a point.
We need another 3 hours here.
Yes, exactly.
I know we can do a part 2 of this, but I think we've had some good bits already. I love the idea of a list to help people just start, because no one's going to change until they actually analyze it and take their own time to critically kind of appraise themselves in the private and have that conversation in their head. So if there was a list which kind of made someone think one point at a time of, I think that's great. I love the idea of looking at how you measure success, getting away from that idea of is the client happy? Because it's moving, you've got to recognize subjective, also get something tangible in there. But also, I worry that our industry, and the reason I have a go at cupping is because visually it's used so much to show, look at me and what I do with my clients. Instagram has probably done more harm for our profession, because how do you put a great Instagram photo of had this amazing conversation where I showed my empathy and they really understood their own body and felt much stronger at the end? What's that in a picture? Just two people going,
exactly.
And yet when you get someone lined up with these, and pins, the same way as the more severe modalities have an effect on the client in terms of relieving pain, albeit temporarily. We know an injection has more of a contextual effect than a pill because it's more invasive. The client believes that's exactly the same with a photo and selling your services to a public. If you show something, the bigger the hammer and the pneumatic drill going on the client's thing, the more, fancy the picture. Some people base their industries on this. So it's tricky. If you're going to be a successful soft tissue therapist, don't base your success on putting photos, because the less photos you can show, probably the more work you're doing.
And let's face it, cupping got popular. Let's face it, cupping got popular because a bunch of swimmers pitched up at the Olympics.
Same as KT tape, it was just sold, wasn't it?
Exactly. And I do think you're right. And the problem is that our society now, where it's based around social media, is based around images. And I can't put an image of a successful treatment consultation, whatever you want to call it, with a client on Instagram, because it just doesn't work. It would be a great long ream of words that no one could be bothered to read.
We have to educate people. We as readers, we need to take our bloody responsibility. And first of all, as therapists.
You've kicked her off now.
Standing up straight.
Somebody was mentioning about meetings. Thanks God for meetings. As a therapist, you should be able to read through the lines of what Meekins trying to say, because actually it's one of the most, sometimes it comes out, I'm not going to use the word compassionate. That might be pushing it.
That's an oxymoron, yeah.
I think his clients are very, very lucky to have him. He really understands his clients. So we need to take the responsibility as much as our clients, society. We need to change our image of what we do to the client, so that the client's expectations are different. So we need to maybe get together as an industry and changing those clients' expectations, because if the client,
right,
and
guys,
I think
go on then, Matt.
I was going to say, and as part of that, I think as therapists, we need to start asking questions more. And I think one thing I'd ask all therapists who are listening today is, next time you sign up for a CPD, if it is trademarked in any way whatsoever, seriously question what it is that's being delivered. Like, seriously question, because if they're claiming a special kind of technique that achieves something special that only they've discovered, I would avoid it with a very, very long stick, because it goes against any of the narrative that we know would actually empower our clients, which is fundamentally, we're here to facilitate you. You can do this yourself.
Right, that's actually one. What I was going to say now is to sum it up. I think listening back to this, a lot has come out, but I'd like we said at the beginning, I'd like you guys to say, right, future soft tissue therapy depends on, sounds like us, the therapists, the people listening, doing what? Let's give 3 things from each of you. Obviously, there's more than 3, but we'll go around. One thing you want people to take away, it won't apply to everyone, but one thing that we need to take away to help our industry survive. Anna, beautiful Anna Maria Mazzieri, what are you going to say?
For me is evidence-based practice in terms of patient-centered care. So if one of the things that people can come out of tonight, that when your client comes in tomorrow, ask them, what do they want to achieve that is meaningful to them? It's not about you, it's about them.
Okay, cool. Sensual, dark, broody, Matt Scarsbrook. What's your one?
Bromance.
Go to Becky. Actually, go to Betty. Betty, you actually have to answer Jack's question first.
I wondered who he was referring to as Betty. Will Betty come on chewing it over? Oh, Betty's
Go on,
Becky.
Betty.
He's always calling guests by the wrong names. I've not got about Granny Donnelly yet.
Of course I will, John. I'd be honoured.
So, Matt, I know there's a few of them. I know it's tricky, but what would you like people to walk away with?
So I would like people to, next time they walk into a room with a client, I would like them to position themselves that the client is fundamentally the one who is fixing themselves. I want them to see themselves as nothing more than a facilitator.
Very nice.
And I want them to try that.
Good words. Even that, just are you a facilitator or a fixer, is something to make someone sit down and go, that's interesting. Which am I? An operator? Anyway, Betty, what's it going to be?
It's going to get stuck as Betty. I'm resigned to that. It's fine. I want us to start working together better. I think it's very easy as practitioners, and a lot of us work on our own, to be in your own little bubble and feel a little bit possibly like you're on the back foot as soon as you're in a situation where you're with other therapists, whether that be in real life or on social media. And I think not just blowing smoke up anyone's backside, but I do think things like this are the start of that sea change, that we can work together, we can support each other, and it's okay to say, should I be using this modality, or can anybody help me with this? And it's all right to start supporting each other and start asking for help and growing together rather than all trying to pull in different directions.
Very nice. Look, there's going to have to be a part 2 of this, I think. But what I'd like before part 2, I'd quite like to base a part 2 on emails sent in to either Matt at the sta.co.uk or Gary at the sta.co.uk about points we've raised tonight. I think it'd be nice to have at least 10 emails from therapists, which then we could answer maybe in here or go through here so that we're not bringing up the stuff. So yeah, do that. Once I've got 10 emails with questions which are relative to the future of soft tissue therapy, then we'll do a point 2, guys. Do you reckon that sounds cool?
Oh, lovely.
That'd be great. Yeah.
And I do quite like the idea of that list. I'm going to badge you, I think, unless it already exists. I like the idea of a checklist for evidence-based or forward-moving soft tissue therapists. Quite cool.
Evaluation one.
Self-evaluation. Well, I mean, we've talked about it previously that, and this is slightly off topic, but on topic. If anyone's ever worked in the corporate workplace, they would have had an annual review.
Yeah.
When was the last time you sat down and gave yourself a serious annual review?
Yeah.
And when was the last time?
Peers, yeah.
And when was the last time that you chose your CPD based on where you want to be in 5 years' time, rather than filling the hours for that year?
It's very good. Very good. You know, right, gang. I've got to go. Mainly because I've got a Zoom call now for One Chat Live. So thank you so much, you three. I knew it was going to be fantastic, and I knew there's going to be a part 2. So thanks so much for giving up your time. If people want to contact you, is there one address for the Massage Collective?
Yeah, so we're massage at physio-matters.com.
There you go.
Or you can find us at the Massage Collective on Facebook. We are officially on Instagram, although you'll notice it's relatively quiet at the moment. So find us on Facebook.
I couldn't find you on Instagram.
I need to do some cupping.
What is it called on Instagram?
I need to do some cupping, so we've got some pictures
This is it.
up there.
We've realised that everything we take photos of, we've just poo-pooed. So Instagram's pretty quiet.
Listen, if you want to do great photos with a message instead of cupping, just follow Tom Colwell, because he's proof that you can get some great images out there without showing pictures of body invasion. Anyway, thanks guys so much.
Thank you.
You can go down to the lobby. Actually, no, you can go now. I haven't got time to say goodbye to you in person. So this is really it. This is goodbye. Once
bye then.
Normally I'd find you in the lobby, but this is really it. This is like, thanks guys.
Thank you to the STA for hosting us.
No problem at all. We look forward to having you back soon. See you guys.
Cheers guys. Good night.
Great, that's brilliant. What a lovely bunch. Seriously, guys, in the lobby, you can go now. I'm not coming down again afterwards. So yeah, that was it. Thanking people in the comments. I always think maybe I didn't get to ask some of the questions in the comments as much as I wanted to, but with people like that, those three in here, I think you'll agree there was so much coming out of their mouths which was important, and I couldn't break them, and I wanted to hear everything they had to say. So I would reiterate, if you haven't already, listen to the Massage Collective podcast. There's 3 of them, but that's beautiful because it starts off at the beginning. It starts off, what does massage do, and they move on to a little bit of education about pain science, and it's just fantastic. And because there's 3 of them, they don't always agree with 3 different styles and backgrounds, then it's definitely worth checking out. And don't forget, as always with these things, don't just the years of just gobbling up yourself and thinking that's going to make me better are gone now. You need to share it if you want to be. That's actually, I didn't say what my point is for the future of soft tissue therapy. I think just sharing more. Yeah, maybe reach out to another tissue therapist who's in your area or who you kind of been watching a little bit, and just say, have you listened to the Massage Collective podcast? No, I haven't yet, but someone else said that about me. That is, I think, a positive thing for the future of, just like Becky was saying, just sharing, being a bit more collective. So yeah, try and reach out to somebody you don't know, who you know is in the same industry as you, and share something useful. Maybe the STA nights, bring them along here. Whatever you think would help. Apart from cupping. Right, that's it, guys. The reason I have to rush off so quickly is because obviously coming up on Thursday and Friday is the what's it called? One Check Live International Running Conference 2020. I'm gonna be online all of Thursday, all of Friday. It's the same as One Check Live podcast, except there's going to be about 8 episodes back to back, 2 days in a row. So basically, join me if you can. If you haven't got a ticket yet, STA20 gets you 20% off. There's also going to be a load of great prizes during the live days, which you won't be able to get if you're watching the recordings. Although, just to reiterate, the tickets do include a recording. So if you're worried about missing part of it because you're in clinic or whatever, then don't worry. If you buy the ticket, you still will have access to everything you've missed. Do try and come along to the live things. A bit like these, there's going to be a lot of chat, a little discourse. These 3, I forgot to say, are going to be joining me on the, what do we say? Thursday or Friday? The Thursday at lunch. I think we booked that in. Have we, guys? Someone put a thumb up? Yeah, wicked. Yes, the Thursday, these 3 are going to be joining me during the lunch break to have a little chat about what's happened, what's coming up, giving me their perspective. So I'm looking forward to that. And there's going to be a lot of that. So if you want CPD, 2 days off, follow all of this. There's going to be so much, so much, I promise you. And if you are in any kind of real financial dire situation, then do feel free to email me. If you can convince me that you have suffered sufficiently, then I'm happy to give you a discount, because it's all about inclusion and recognizing that a lot of people in the industry have suffered. So yeah, email me, matt@OneChatLive, if you need that. Right, I really have to go. Thank you so much, everybody, for joining us. I think it was probably a record tonight. I think we got 59 or something at some point, which is amazing, because you look at other shows online live and they're like 10s, 20s. It's not a competition, but I really respect you all for giving up your evenings and coming on to contribute to these STA Let talk about. So give yourselves a clap on the back. And yeah, we will see you next week, which, if I remember rightly, is going to be Grenier Donnelly. We're going to do a special on women's health, which I'm very looking forward to. Something our profession needs to know about. And that's going to be next Tuesday with Grenier Donnelly, who's one of the authors of the Return to Running Postnatal, along with Tom Goom and Emma Brockwell. Emma will be speaking at the One Check Live conference as well. Right, I must go. I'm blabbing on. Thanks, guys. Take care of each other. And we'll see you next Tuesday or Thursday, Friday. Bye all.